welcome to the Rise World Summit. This is a really unique, as I said, our signature event at the Rise World Summit where we have roundtables. And the reason we say that there are conferences, unconferences, and then Rise, because right through over 100 hours of programming across 3 days, we have no panels and presentations. This again will be a special experience, I hope, for many of you. And we would love to get your feedback, but most importantly, want you to understand that this is really so that we have outcomes that we take beyond this. And many of you would have read the concept note that talks about that outcomes. And to set the context and get the ball rolling, may I please invite Rajeshwari Chandrasekhar, who everybody knows her so well as a Chief Field Officer of UNICEF Mumbai. She's been with us in Maharashtra since June of 2013. But I must tell you all this, she's been with UNICEF for over 26 years, both here in India and abroad, in Indonesia as well as in Kenya. And until her return to India, she was the Chief of Social Policy, Planning, Monitoring and Evaluation in UNICEF Kenya. She obviously comes to UNICEF with a very strong research background, and which is why it's so anchored in everything when we discuss and talk and do with her. She holds a master's in economics and has published papers in journals like the Economic Political Weekly, and of course, notably on child marriage, a topic very close to our heart. So Rajeshwari, over to you and to get us all started. Thank you.
Thank you, Karon. Yes, this is indeed the 9th edition for you, but the second one where we are co-hosting with you as UNICEF, and a lot of good lessons learned, a lot of networks, a lot of topical issues. Yesterday's plenary was particularly the curtain raiser when you had 5 powerful women speaking on the rise values of responsibility, inclusive growth, sustainability, and a sustainable ecosystem as well. So good morning, everyone, all of you here who have come for this thematic discussion or a roundtable on learning recovery. I'm as excited as you would be to be here at the Rise Summit Roundtable for yet the 2nd consecutive year. I also want to take this opportunity to congratulate the entire RISE organizing team for bringing this summit to its 9th year. Today's discussion, as we will go very quickly into it, is on the learning recovery back to school. And we have seen what it means for the last 2 years, thanks to the pandemic. And therefore, it is something very close to our hearts at UNICEF. And I'm sure you, all those of you who are part of this roundtable, will agree with me here. Although much has been written about the impact of school closures on children, we have only, I believe, been partially successful in getting schools to reopen. In India, there are some state governments which have yet to take a decision on reopening the Anganwadi centers and the preschool, pre-primary schools. And these extended closures are despite the growing evidence from the field of education and health, particularly the epidemiology of the pandemic, which indicate that the youngest children suffer the most from school closures and are also the least at risk of severe COVID-19 infection. So we have today a very diverse group of some of the best brains, the best talent, to deliberate on some of the issues related to school reopening and offer possible solutions to ensure that children, and especially the younger ones, do not lose more than what they have already done or lost since the last 2 years. I want to just take a live example that I have experienced myself, and this was way back, let's say 15, 20 years ago, even before we knew the P of the pandemic, where I was trying to do an early childhood education program for children in jails. And the children were in the jail or the prisons because their mothers were convicts. And, the child would stay with the mother and go around, and there will be these cats and dogs which will just be loitering around in the prisons. So the child was only used to seeing the cats. When one day the mother went to the court for hearing when her turn came, and she, of course, took the child with her because the child was too small and had to stay with the mother, she saw a cow on the road and she asked the mother, "Is this a bigger version of a cat?" I leave all of you with this thought that if this has happened before the pandemic, now the houses in which we keep our children closed just because you cannot go to play, you cannot go to school, you cannot meet your friends, they are getting in a way prisoned in their own homes. We do not want that generation lost to realizing that a cow is a bigger version of a cat. It does tell a story, and I'm not cooking this up. I've actually heard the mother and the child talked to me in the prison when I went for this program years ago, many years ago. But that is something very telling of what we do not want to see in our younger generation. And obviously, digitalization is not the answer for this very small group. So, something that we'll have to find very alternative and innovative methods to get children to learn despite the pandemic. So I do look forward to a very enriching and a very inspiring discussion. Thank you. And I now hand it over to Karen to actually introduce who are these august speakers and the moderator of today's session on learning recovery back to school so that we will take this roundtable discussion forward. Thank you.
Thank you so much, Rajeshwari. And as always, you always make us think harder, deeper, and further. So thank you very much for setting that context. I just want to maybe take another couple of minutes to talk about the format and the introductions that we are going to have, and then of course hand it over to my August co-moderator, who's actually moderator, who I will be co-moderating with, Dr. Vinita Kaul. But to first, a little bit on the format. As I said, we have no panels, no presentations, and yet, of course, all of you are here as experts, because you have such amazing experience and knowledge. And so, therefore, we will be bringing you in as the people who will guide this conversation and ensure that we have outcomes for it. And the way it happens is in three key buckets that we call the 3C methodology that we follow at the Rise World Summit, which is challenges, capabilities, and then collaboration. So obviously it's very the challenges are about the obstacles, issues that we face. The challenges are the interventions and solutions that are currently prevalent and which we would learn from. And then of course collaborations are offers for us to do things jointly, whether it is resources, whether it is new projects, whether it is even funding. It could be anything that could come out of this. And so we're really looking at these kind of evolving solutions and opportunities that could finally get into the report and the papers that we are planning to do post this. So also another thing that, because many people tell us that 2 hours it's just too long, but honestly, and by our previous 5 roundtables, we have gone over by 10 minutes in all, and only because we capped it at 10 minutes over. Easily we can do another hour of conversations because it's so rich, that the experience that is you're right here on the table, right? And so to save time and to avoid losing even a minute of it, and I will also quickly stop talking, is to please request everybody as a very quick intro, to yourselves. Just put it on the chat box. It'll help people to know who's on the table. Also, as Deepak suggested, please change your names, and I'm going to do it for myself. Add your city or your country after your name and your organization. I think it'll help a lot of people know very quickly who is talking and where are they from. So I'm going to do that, as I said, right away myself, right? And last but not the least, I'm now going to, so yeah, as I said, please use the chat box, keep that coming. Also, based on the, I'm not sure how many of you in the physical world have seen when roundtables have, a large number of participants, and we definitely have a decent number, not decent, very good number of 85 people. It's difficult to bring and talk to everybody together, and the virtual world, of course, has its own challenges. So what we do is you have 2 circles, right? You have the inner circle and then the outer circle. And so what happens is we want every voice to come in. So while the inner circle obviously would be our experts who will be guiding the conversation, we definitely want the outer circle, which unfortunately, as per the tags, which is technology based and I can't change it, is the attendees would therefore be able to come in through the Q&A, and you can only attendees can put it in the Q&A section. Any panelist who wants to raise a question needs to put it in the chat box. Yeah, just a little bit of housekeeping guidance over here. So this is how it will pan out, and we'll try as much as we can to bring in as many voices as possible. And for that reason, I'll request everybody, keep your answers, keep your comments really crisp and concise so that we get as many voices as possible into this. And of course, talk to the room. Let's talk for something that the room will gain from, or which you can take back with you, because that will become really, really helpful for us to make sure we have the outcomes that we desire from this roundtable. Yeah. So with that, I'm going to very quickly introduce the moderator for today's session, who is none other than Dr. Vinita Kaul, currently the Professor Emeritus in Education at the Ambedkar University, Delhi. She's also engaged in an honorary capacity as the Chief Editor for a journal titled Children First, Journal or Life, which is being brought out by the Delhi Commission for Protection of Children's Rights. I must also inform all of you that while we asked you to do your introductions just now, and we're giving very brief introductions, the full introductions will be put on the chat box. So keep your eye on it. Just as there are challenges with the virtual world, I think there are also great advantages, because we can have a parallel conversation going on the chat box. We can also leverage that very effectively to ensure that every single thought is registered over there. So please go ahead and use that and keep a watch on that as well. And Dr. Vinita Kaul, over to you. Thank you so very much for being here, and we look forward to you taking this conversation really into its natural condition. Over to you.
Thank you very much, Karen. And good morning to everybody. Let me begin by saying that I'm very excited to be here. And the excitement is because this is my first experience of this roundtable in virtual format. So, and then to moderate, I hope I will not mess up things, but Karen is there to help me out.
Not at all.
Okay, so thank you very much. First of all, I would like to thank UNICEF for giving me this opportunity to moderate this session, but even more to organize this session, because I think that what has been happening is that there is a lot of discourse around in the country, as a matter of fact, across the world, about the impact of the pandemic on children as a result of school closure, and a lot of controversy regarding whether the schools should have closed or not be closed, and to the extent that the younger children, how much of the pandemic impacts on them. The controversy is there, the discourse is there, but most of it is with older children, with children at the school level. And there isn't enough discussion on the younger child, the child who goes to the Anganwadi, the child who goes to the preschool. What is happening with those children? And even when we talk of school closure, the schools that are at the states that have opened schools, I find that many of them have opened from class 1 onwards, and the Anganwadis and the preschools are still closed. So the slogan today is, if in any such situation, the schools should open should close last and open first. But the opposite is happening, that the schools are the first to close and the last to open, and the preschools are even further neglected. And what is then happening to these children? I mean, this is something that is very, very worrisome, and this is not getting discussed enough. So I'm very grateful to UNICEF for having organized this with the RISE team. And I think that, and not only to do this, but to bring in all the galaxy of experts around the country, from early childhood care and education, who have been working in this area, to be able to do some kind of thought sharing and experience sharing, and be able to come up with solutions. We've already had the pandemic for 2 years now. The children have been in school at home for the last 2 years almost. And initially, of course, it was an unprecedented situation, and we had no idea how to handle it. But over the 2 years, there have been a lot of experiences. I'm sure there have been a lot of innovations, initiatives. And so this is really a wonderful opportunity for all of us to be able to learn from each other, share with each other, and be able to come up with some kind of a constructive solutions for the way forward. Because as epidemiologists say, that the pandemic is, or the COVID is here to stay. If that is so, unfortunately, then we will have to find solutions to be able to live with COVID. Some of the main issues that I think that really come up, and I'm glad that this has been raised by Rajeshwari earlier, is this whole issue of whether schools should be opened or not during the pandemic, and when should they be open, when should they be closed, what are the health experts' views on these, given the experience of the last 2 years. There is also this whole issue of the younger child, because all the discourse that is happening is with learning loss. And the learning loss is to do with largely with academic learning. That is what is being talked about, how children have lost their literacy skills or numeracy skills. But when we talk of the younger child, how do we see this learning loss? That is one of the issues that we need to be discussing. How do we, is it a learning loss? Is it a learning lag? Is it a developmental lag? What is it? What form would it take, the impact that is happening on children? And how do we really look at it, and how do we address it? There is also the third issue there, also that it is not only the question of the learning lag or the developmental lag from the point of view of academic or pre-academic learning, but also in terms of health, nutrition, because the schools for children or preschools are not only places for learning, they are also places where they get food, they get health services, they get opportunities for many other modes of, for nurturing other modes of their development. And I think that it's a very, it needs to be looked at much more comprehensively. So I'm glad to say that we have experts from all these fields who are being engaged with this, from health, from child psychology, from child development, education. And I'm personally looking forward very much to this discussion. So Karen, should I just get on to inviting?
Absolutely, ma'am. Please go ahead.
Okay. So I would first request, invite Professor Shekhar Seshadri. I mean, I think they're all old colleagues and very well known to me. So it's really very, very exciting for me to be able to hear everyone bring in their experience into this. Professor Seshadri, if he's there.
Yes, I'm around, Vinitha. Yeah.
Good morning to you, Professor Seshadri. The question that we would like you to address for us is that despite the best efforts to reach children during the closure, the youngest children have had limited learning opportunities at home, as we all know. Given your expertise, I think I should be introducing him first, because when I'm talking of his expertise, he has a wide range of expertise. He's the former head of Department of Child and Adolescent Psychiatry and the former Dean of Behavioral Sciences at NIMHANS, and a wonderful speaker. I've always really appreciated whatever his views and his mode of expression. So the question to you, Dr. Seshadri, is that despite the best efforts that have been made to reach children, the youngest children have had, as we all know, very limited opportunities at home. So given your expertise in child psychiatry and child psychology as well, what are some of the challenges you feel in reaching children, and how do you think this has affected their all-round development?
Thank you very much. The issue, Dr. Cole, as you raised about younger children, so I'm not going to take my responses to the parental preoccupation about exit exams for those who are in 10th grade and 12th grade and wanting to take competitive exams to get into professional colleges. That is another debate. Now, I recall Safdar Hazmi saying many years ago that the limit of your capacity is the limit of your experience. Let's link this to the whole issue that brain cytoarchitecture occurs maximally in the first 3 years of life. 90% of brain development is over in the first 3 years of life, and therefore, you know, the 1,000 days concept that one has in mind. Now, what has the pandemic done in terms of preschool and the world's largest welfare system, which is the integrated child development scheme in the Anganwadi system with closures? Now, my concern is about the 0 to 3 and the 3 to 6. And here is why. That if stimulation does not take place in 0 to 3, and there is an assumption that stimulatory activities come naturally in the context of a lockdown, particularly in the kind of predicament that many vulnerable families face. And let's recognize and acknowledge that pandemics of the nature of COVID have a disproportionate impact on the more vulnerable populations, marginalized migrant workers, daily wage workers, and so on. I'm also concerned with children with special needs, and they are not insubstantial in number. So this is one issue. The second is we have an entire cohort of 3 to 6 year olds who are missing out on the social context of learning. And here is a robust opportunity for developmental psychologists to actually look at what the impact of this loss of exposure to the social world is going to have on these 3 to 6 year olds 2 years from now, 4 years from now, 10 years from now. And will it make a difference in some of the foundational skills? So some of these challenges have to be reconciled with some of the dispensations that have been recommended in NEP 2020, and to really revitalize the Anganwadi and the preschool systems. And in fact, many of the panelists present here today have been part of an initiative that the government of Karnataka Department of Women and Child has started, when we're really looking at examining this and doing a concerted effort. That two final points in this round, and perhaps we'll have time for some other comments a little later. We are right now in NIMHANS engaged in a national initiative in child protection, mental health, and psychosocial care. And for us, the issue of protection is not just risks from acts of commission, such as abuse, it is also unmet developmental needs of children. And so what we're going to do is we are taking this whole idea of preschool and the Anganwadi system into the districts, into the panchayat system, to work with about 118 aspirational districts to look at that administrative structure through materials using a community approach and direct work with parents, which is anthroposophic in nature, to quote Rudolf Steiner. If the children cannot go out into the world, how do you bring the world back into the family in the 5 domains of child development, so that as and when the pandemic abates, whenever that will be, and schools open. The last point is about schools. There are safety protocols. There is what has been referred to as developmental lag, learning loss, learning gaps. But there is also socio-emotional learning and mental health issues. From what circumstances are these children coming back to school? Are they compromised family circumstances? And if that is not addressed, it is not merely the loss of learning. It is also the fact that this is compounded by some of the psychosocial issues that impinge on children's experiences and what they have to endure, and their predicament thereof. So this is a framework of the kind of challenges that we are dealing with. And through Samvad now, we are working in 29 states in 4 verticals: protection, education, mental health, and policy and law. So we hope to use this network, and indeed the network that has gathered here today, to disseminate this idea. I've taken the liberty to put on chat our website and other materials, which is in public access free domain, because as I have often said, we do not believe in copyright, we believe in copyleft. Over to you, Vinita.
That was so wonderful. And Vinita ma'am, if I could just make one more suggestion, that for the same question, I think we have one more person who could come in very nicely, if that's okay, and ask Chitrajan to also maybe answer the same question. Is that all right? Yeah, Chitrajan, may I request?
Thank you. Yes, I was just going to say, whenever my turn came, I would say I agree with everything Shekhar has said.
Well, it's right now. It's right now. Go ahead.
Yes, I think I think there are, for me, there are 2 important things. Everyone has been talking about the question of learning loss, the question of, and most of the time it's been talked about in the context of academic learning, unfortunately, and I think Shekhar simply brought in that entire dimension to it. And the way I see it is, I think the key question to think about is, the loss of well-being. And that's how I like to think about the challenge in front of us. I think it's clear that, as Shekhar was saying, the children who come to schools or Anganwadi centers or whatever, and the 0 to 3, those who are children who are 0 to 6 in some cases, who are at home, will have experienced economic deprivation, hunger, malnutrition, domestic violence, parents' stressed emotional state, loss of social interaction, isolation, illness of close relatives, resultant panic in the family, bewilderment, grief, hopelessness from the loss of a loved one, possibly. And we know some children who have lost both parents. There's destitution. There's all of this stuff. And this is true for youngest children as well as older children who come to school, etc., etc. And to me, the idea that we are thinking about when to open schools or Anganwadis or whatever, on the basis merely of saying, have the infections receded sufficiently? Are they now at a level when we can safely bring children in? Misses the point that we're going to have children who come into the school or the Anganwadi today, who are very different from what used to be there 2 years ago. They have gone through all this. These are traumas. These are traumatized children. And our challenge is that the adults who would have been expected normally to hold such children as they come in are themselves traumatized. They have also gone through the same stories. They have also gone through the same experiences that they have. And so, they're themselves stressed and therefore not necessarily in a place to be able to offer the kind of nurturing environment that might help these children back from where they are. And the other challenge really in some sense is that even in normal times, we have not prepared our teachers to deal with trauma, to deal with stress. There's nothing, if you look at how our parents, how our teachers have been trained in all of that to deal with something like that. So much less in a crisis situation. Even in normal times, they're not really trained. They're not, capacities haven't been built. So to me, it seems that we might have an opportunity in many ways, twofold opportunity, I think. One is to say, this is something that our adults in the education system should have learned, even in the normal course, and then they would have been much better prepared for what we are currently seeing, but they don't have, and therefore we do have to do that now. And we have to do it in some sense on an emergency basis. It's a mission. You just have to get to it very quickly without wasting any time. That's one piece that I think is important. How do we sensitize an entire 80 lakh adults or something like that, 1 crore adults, on how to have a nurturing environment in a classroom when children come into it, traumatized and so on. And the other thing I feel, and this goes more to the school education side than to the early childhood side, I think it will be very helpful for us as we all talk about the loss of academic learning. I think it might be helpful to say, how much learning was there already in schools? We know the results of what we have seen, the ASER reports, the others. If there wasn't much, and that's what all those reports would suggest, that in the first place there wasn't much academic learning happening, then it might be worthwhile for us to say, how do we take this as an opportunity to redesign our curriculums, our teaching processes, our teacher training processes, our classroom processes, so that what is undoubtedly an inefficient education system, whether you call it technically or socially or economically, is it possible now for us to redesign that process? Simply because we have to, children have lost 2 years, 3 years, something like that. We don't know how it's going to, we still don't know what's going to happen. So we really need to think about what are more efficient ways in which, even if children have lost 3 years, we can still get them to the level of proficiencies and skills and so on, which they should get. And once we can figure that out, and I have no doubt it's possible, I know it's possible. And once we get to that, then what we end up with is a system which can use those learnings for the future, even when things are normal. So I would leave it at this point there. Those are my thoughts at this time.
Thank you, Chitranjan. I think you really emphasized the need to look at this as an opportunity to reimagine education. Reimagine not only early childhood education, but school education entirely and everybody in it. The challenge is also the scale that we have. So somewhere I think we need to also be discussing how do we address that scale. Is Shubhra Chatterjee there? Can I call
hello, I'm there.
Aisha. So nice to see you, Shubhra. Chitranjan talked about the school system and how the school system needs to be now geared towards facing any such pandemic or any such disaster which will impact children. But yeah, he's talked about the teachers and he's talked about the children, but there's also the other third angle of the triangle, that is the parents. And I think it is, we have last 2 years, there's been a lot of dependence on parents to be able to sustain the learning of children to the extent that they could. So what has been your experience, and to what extent have the parents been able to meet that challenge, since that has not been earlier their role? And what is it that needs to be done to be able to really strengthen this supportive role of parenting?
Thank you, Vinitaji. I will, looking back while reflecting, I feel that I will divide it into this year-on-year basis. 2020, there was a set of problems, and the problems evolved in 2021 and now in 2022. So when I think of that, we have been working with parents in quite a few states. So this is very similar and some were different, but the year one, the main challenge was the suddenness of it all, and switching over to, and the shock of it all, and the panic around COVID. And parents were not really mentally geared to take on that extra role that was being expected of them, ki you also look after children's education. And this has not only happened with parents from vulnerable backgrounds, but also middle class. And we see that, parents were just mentally not prepared to take on this role. And they did not have the mind space, and they were under a lot of stress. As Chitranjan mentioned about the loss of livelihood, income, the suddenness of it all, the first 2-3 months, it was bewildering for everyone. And I am not even talking about the access issues that has been discussed a lot, but where we managed to go out and meet the parents. So initially there was this, hum nahi sakat, humse nahi hoga, ye hamara kaam nahi hai, because of the low literacy levels there was, and then we don't have time. And so they needed a lot of counseling, a lot of support there to be able to, adjust to the changed reality. And then once one parent said that I am not a teacher. ये तो school का काम है, ये तो आंगनवाड़ी का काम है. Then we are not expecting you to teach, but we are expecting you to just spend some time with your child so that because a lot of children were they were facing severe, they did not know behavior management at all, the parents. And so that was also, so it was not that we explained that we are not expecting you to become educators, but that, and it will contribute. Chintarajan was talking about mental well-being. And once they did it, they realized, and we got reports of, how this, the kind of sitting and doing activities with the children, talking, playing with the children, really managed to improve the mental health of entire families. And then we consciously said, it is not only the mother, but the father, the grandparents, whoever is there, please spend some time with your child. And we got back reports after 3-4 months that really it has made a difference. And they said that we didn't know how to really deal with our children. So this was first year's experience. Second year, the brutal second wave, and I think some of the pattern of first year got disrupted because everyone was at home. The male members were at home. The mobile phones were accessible in the families. you know. So when that started happening, the earning members started going out, the access was not there. So another set of challenges happened, and we had to readjust and find other ways and means of doing it. And then since things had opened, we were calling parents to the Anganwadi centers. So this was happening more, but constant interaction and constant counseling. And in the third year, I was so happy to listen to Shekhar Sheshadri. We didn't know, but we realized that we were making home visits. We were calling the parents to the centers, but this whole social process of learning. So we just took it out to the community and organized community-based, where entire the panchayat members and the adolescent girls and everyone there, even if the child was not in the Anganwadi, they are together, having these, and a lot of energy and a lot of discourse is being generated. That is all we wanted. And the other thing that comes to my mind is, yes, the home-based learning packages are being sent out, but there is this thinking in the state system that it cannot be a substitute. We are not expecting parents to become teachers. It is just parenting practices, improvement of certain parenting practices, and then there are some places where they are saying कि ये thematic होना है, ये aligned होना है हमारे curriculum से. What rubbish! I mean, they're so burdened already, and you want to burden them further. What we just want to tell them, just enjoy your time with your child, spend some time happily with your child, and can do these things. Just giving them ideas, not a package curriculum, something like that. But that is also the thinking, and unfortunately, there is this thinking कि सारा कुछ substituted हो जाएगा, even if school, and therefore this extreme kind of apathy about opening schools. They think that is a solution. If opening 500 television channel is the answer to learning recovery, I really don't know what to think. And the other thing that I want to talk about is we have been doing a lot of, data, just to find out what is happening. So there is a gap with the messages and all that are sent out. So there is a gap between what we send and what they receive, and between receiving and viewing, and between viewing and implementation. And it is those gaps that we are trying to identify. The problems of parents is not that they are not willing. It's not that they don't want to. It's not that, but what are their problems? So whatever we do in designing, because this kind of thing is likely to continue in the near future for, I don't know, intermittent closures, and parenting is I can see this good quality is he centered, and parenting will together make a good early childhood program. So this has to continue, but the designing has to be very good, and it cannot become a substitute for learning in the Anganwadis. And the expectations from the parents has to be realistic, because what we are learning and what we are finding out that 3-4 times a week, maybe half an hour to 1 hour is the average that they are able to do. Those who are willing. Of course, there are outliers on both the sides, some who never do and some who do a lot. But the average, that is the learning that we have got, is we have to plan something realistic, and parenting cannot become teaching that way. We have to keep those lines, and it cannot become a substitute for actual, Anganwadi functioning or school functioning. So I think this is what I wanted to share.
Thank you, Shubhra. I think that's, I'm very, very happy that you said that parenting is not about teaching. It is about being better parents. But the trend has been that you have worksheets sent home for children to complete the syllabus for the teachers. And that, I think, somewhere is a kind of a misunderstanding of how parents can be involved. So I'm very happy that you have brought in how it's taken time, but over time parents have become more responsive and have created more bonding, family bonding. This whole effort has created a lot of family bonding, which I think is very, very good from the wholesome development of children. Did you also address, hear of or experience any kind of domestic abuse increasing as a result of the pandemic, which has been reported in surveys?
No, it was very difficult to find out, but our people got a sense that situations were pretty tense. And I think the mothers were having the toughest time. They are very low down in the power hierarchy. And it's the mothers and young children, They had, and so we thought of, actually there's open air meetings and all we thought of is because to, come and bring it out in the open, because a lot of mindset change needs to happen within families. The role of the mother, and she has no place to, she has no outlet. I read somewhere that the mother screamed one day somewhere in the park in Japan or some other place, then, but we do not have a platform for mothers. We should think that, where they can vent their emotions and feelings, and we don't have anything for them. And they are the ones most, and how much can an Anganwadi worker do? I mean, she tried her level best, and she got a sense that there was a lot of, and children were getting beaten up because just the mothers, and the mother was taking out her frustration. I'm very empathetic with the mother. I mean, I will not blame her at all. But she is under a lot of stress. The entire, the toxic levels of stress, second and third year with this prolonged period, and it is having a toll on the mothers also.
I think there are many mothers in this roundtable itself, and a lot of them are resonating from the comments in the chat box. I can see that a lot of them are resonating both on the parenting and not teaching kind of this thing, as well as on the stress aspect that you just spoke about, Shubhra. So
we should do something for the mothers.
Absolutely. And that is a thought for us, an action point that I have put on the group chat as well to make it going on. Over to you, Vinita. Yeah, absolutely.
Can I just come back to Farida Lambe later and just move on to Swati Popat-Watts, because we're talking about parenting, and technology has played a major part in being able to reach parents, and that also resulted in our understanding of the digital divide. So I think everybody knows Swati. She is the president of the Early Childhood Association of India, and has done amazing work with getting all the preschools around the country to activated and interested in early childhood. So Swati, what is your experience of reaching out to parents, particularly in the affordable and the more elite private sector? And because parents are the same no matter where they are, or are they?
Absolutely.
I mean, I could even maybe ask that question. Yes.
Namaskar, everybody. And Dr. Kaul, it's always a pleasure. I look up to you as my guru, and it's a pleasure to be here on this panel with you. Thank you to UNICEF for inviting me and giving me this chance to put forth my points on this very, very important topic. At the Early Childhood Association, technology was the first thing that we fought with when the pandemic started, because there was a lot of resistance from everywhere, naturally, the governments, parents, that how will you use technology for early years, So we were part of a lot of government committees, especially Karnataka, and we helped formulate the guidelines for how to use technology for the early years. We also started a channel on Facebook. It's still alive. It's still live in 8 languages, in 8 Indian languages. We are doing sessions for parents, for teachers, for children every day for all the age groups. And on Tata Sky channel 664, we've started something for mothers and fathers. These are games in English and Hindi that parents can play with their children using indigenous materials, easily available materials. So we've tried to do our best to reach out to all children, irrespective of their social status, etc. But I feel the pandemic removed this entire thing of social status. Every mother, every father, and every child was struggling with the same things, which was common all across. One of the problems about technology was the access, of course, to gadgets and Wi-Fi. Even those centers which had it, buffering was a huge issue because it used to frustrate the teachers. It used to frustrate the children. You are in the middle of hearing a story, or you're in the middle of enjoying a song, and you suddenly lose the link or the screen freezes. And at that age, the children, to handle this kind of a stuff kind of makes them lose their interest in coming back again to any other session. So that was one very important issue. Children, as we all know, thrive on serve and return interactions. So it is, of course, better to have these interactions on Zoom, etc., but not possible sometimes. But to the children for whom it was possible, we had trained teachers to help them understand that, have welcome songs in which you are taking each child's name, because that becomes very important and boosts their self-esteem, that that person on the screen is able to see me. Because children at that age were only used to television, which was a one-way process. And for them to get used to that, okay, this person in the screen can hear what I am saying. And of course, we had to train teachers to not keep on saying mute, mute, put yourself on mute, because that was something that we told teachers, don't do that. It's okay if 20 children speak together, let their voices be heard. It's important for them to hear others also, rather than sit nicely in front of a screen and just listen to that teacher on the screen. The whole fun of the session should be in that. Children get otherwise lost on the screen. They are just stamp size photographs. So it is very, very important we train the teachers to look at the camera and not look at your screen or the child, because to the child that eye contact becomes very, very important. So it was these little simple things when we trained teachers on, their sessions became better. The interactions of children on their sessions became better. One of the major problems of using technology is the teaching maxim, concrete to abstract. Everything is abstract on a screen. In a classroom, you can hold an apple and you can show it to children and they can see it in 3 dimensions. They can touch it, they can feel it. In technology, everything is abstract. There is no concrete. And that is why, to overcome that, we used to train teachers that ask children to get an item for the next session. So each child is touching that item while the teacher is talking about it. So, there were so many loopholes that had to be taught to teachers to overcome, to make technology a tool that can be included rather than a hurdle that had to be crossed. Also, what works is parenting involvement. And it was important to train the parents also to understand that it's okay if your child doesn't sit. Most of the parents were very, very about, sit in front of the screen, sit, my child is moving around. So it was very important to talk to the parents that it's okay. Sometimes children listen and they move around. So we also included podcasts. Podcasts work brilliantly because children like to listen to stories, even if they don't want to see the screen. And you can record podcasts in their mother tongue. So it was very helpful both for the parents and for the children. That has worked brilliantly. I would suggest to people who don't have access, use podcasts, send them on WhatsApp to parents and let them use it, because that really, really helps. I think what the pandemic has taught us, Dr. Kaul, is that technology is not that much of the evil as we thought it to be. It actually became the only tool that helped bring us together. But one of the biggest worries, I think, that we should all worry about, pre-pandemic, we were worried about the learning divide. Pandemic has brought about a digital divide and has also brought about a pandemic divide. And I call it a pandemic divide because, for example, preschools in Punjab opened last August, whereas in Maharashtra opened in January of 2022. So think about the children now, pan-India, are losing out on preschools, on physical learning, be it in Anganwadis, be it in private schools. That divide is going to be huge in this country. And that is why I feel, what you said at the beginning, Karen, is that we should have a common guideline to all states of opening schools first and closing them last. Because left to each state, the children of that state are going to suffer. And especially when you will have these children moving from one state to the other, that learning lag is going to be very, very evident. And for me, learning is not about the numbers and the letters, etc. We need to change parents' mindsets from what to learn to how to learn. When explaining to parents that play is the magnet of learning, it's okay if your children don't know the alphabet, it's okay if they don't know the numbers. If they are playing, that means they are learning. And that is one thing that we did by explaining to parents that the right brain develops first. The right brain thrives on play. So if you want your children to remember anything for life, stimulate the right brain, and it can only be done through play, and that is why play activities. So use technology to pass these messages both to parents, to teachers, and to reach out to children, because language was something that they were missing out. Parents were not speaking to their children. So just to get somebody to speak to them, to sing to them, to tell stories to them, I think that was one of the best uses of technology that we can make.
Thank you, Swati, for sharing your experience and for giving a lot of leads into some kind of solutions to problems as well. I think one of the major challenges with technology we've been talking about is the screen time that the children have had to undergo. But again, I think the choice is between which is the lesser of the two evils, because somewhere no stimulation, no interaction, or some interaction through technology, So that, I think, is what we need to be resolving and working towards. Since you mentioned the pandemic divide, that helps me come to the next, to bring in Farida Lambe. She's been a very well-known, also does not need any introduction. She's the co-founder of Pratham, and the founder trustee. What, if Farida's there?
Yeah, I'm here. Yeah.
Hello, Farida. The issue that Swati raised about the pandemic divide, that some states are closing and some states are reopening and some states are continuing to close. Yesterday I was talking to somebody in Karnataka who was saying that the schools have reopened, but only from class 1 onwards, and the Anganwadis and preschools are still closed. So why this discrimination? What is the reason for it? And what, in your opinion, are some of the reasons why that are sort of influencing this decision of the governments, state governments, on opening or not reopening? Would you be able to share some light on that?
Yeah, sure. First of all, let me thank you and, of course, UNICEF to bringing all of us together. It's always a pleasure. Having said that, I think I want to just go back to what Dr. Sheshadri and Dr. Chatterjee said, that when you're talking about, pandemic, and we've talked a lot about pandemic, in terms of the learning loss, and we will continue to talk. Coming to your question, Vinita, I really don't understand why there is so much of hesitancy in opening schools, and to close schools. We many states are the first states to close schools, and I think one of the natural fears, to my understanding, is that what if children get infected? That's one. Secondly, I feel the other fear is that children, if they get infected, they will bring back the infection to their families, and the families, we have elders, we have grandparents, and they will get infected. Third, I think many states, I can talk about Maharashtra, was also relying and dependent on the health task force and the doctors and the medical fraternity, who are looking at this entire pandemic, and closure of schools or opening of schools from the health parameters. They were not really looking at from the educational parameters. Also, another reason is that there was a divide. There were some parents who were in the first wave and in the second wave were determined that they will not send their children. But as a third wave, now recently, I think there has been a kind of a voice from the parents that we want the schools to start. Also, I feel there are political reasons. Elections on the cards. If something happens, something goes wrong, what will happen to us? So I think there are also political reasons, and in some states, I think these civil organizations or the civil society voice was missing, while in some states the civil society voice was very strong. So I think there are various reasons, Vinita, but I would say, and as many panelists have also said, you yourself said, Karen said, that let's look at this from a way forward, that crisis will always happen, disasters come. What guidelines we should have for opening and closure of schools, and can we do without closing of schools? Can schools always be open? And one of the school of thought, and there is another some groups working whether it can be one of the essential reasons, essential services. So I think that is what one needs to look at. There is a lot of legal implications in all this, but for me, I think closure of schools was just to be on a very very safe side and not taking really risks, and not really relying on the scientific data, which was all the time saying that children will be least infected, and even if there's infection, it will be mild. I also feel ground realities, Vinita, and have been quite different. While we are saying that pandemic is there and children, there has been a learning loss. We've seen, and in Pratham, we've seen, many of my colleagues are on this call also. We've seen that wherever there was a connect with parents, we as an organization were able to actually connect with our parents through WhatsApp, through SMSs, through radio programs, where we kind of gave them confidence. Like Dr. Chatterjee was saying earlier, that let's not talk about curriculum. Let's talk about safety. Let's talk about security. Let's talk about health. And we had a one campaign going which we call thodi si padai thoda sa corona suraksha, and I think that went off well, because one of the key points in all this is that when you connect with your community, why I'm saying this, Vanita, though you've not asked me this question, is related to school opening and school closure. When you have a connect with the community, you need to rely on your community, and you have to take the parents with you. And what we found was that the parents were extremely happy with us when we were phoning them or we were sending the messages, because they were saying that तकलीफ के time पे भी हम ये लोग हमारे साथ है. When they're nowhere to go, nobody to listen to, I think we were at least phoning them and asking them what to do. And the point related to this is that UNICEF and Pratham and another organ called Sacred, we've come together for something called 100 Schools, which I'm sure somebody will talk about later. But there also we found that if you work with the community, and if the community decides that schools should remain open, that our children should be safe, I think it's much easier. So my point on this is, Vinita, is that the pandemic has taught us many things, and one of the most important thing which has reinforced is parents are here to stay. School is not the only fountain of knowledge. We have to take the parents' support in the child's learning, having fun, enjoying. And with Ms. Chatterjee and Chatterjee, when they say leave the curriculum, we are also saying leave the curriculum aside. Let's just have fun. In all this depression which is happening, let's have some hope where children start enjoying and have some family time. I don't know, Vinita, whether I can continue or whether you want me to stop.
Can we bring you in a little later again?
Yeah,
If
okay.
you don't
Yeah,
mind?
yeah,
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 because
yeah.
I want to very quickly bring everybody's attention
Sure,
to that
sure.
time.
Okay, sure.
As I said, 2 hours is never enough. Everybody doesn't believe me when I
Yeah,
tell
because
them.
I wanted to just end this
Sure,
one
sure,
point, because I won't be fair to myself. Is
please.
that because when you're talking about doing things and dreaming, I think we've done it. We've got 40,000 focus groups with the mothers, where the mothers are very actively involved in having fun with children. It is not about only learning. That how do you really connect the mothers? I'll come back later. Yeah. Thank you.
Thank you so much. As I said, I just wanted to bring everybody's attention to timing, because we just have another hour, less than an hour, in fact, and I'm already warning everybody, I think. And of course, if it's everybody's choice, we may just go over time a little bit. So please plan for that. And of course, as based on the, if everybody's all right, we will take that, poll at the end. How much further do we kind of go further, so that we make sure we can cover everything. Also, I feel maybe just before we close the challenges and move into capabilities, because Farida did touch on that, the way forward, right? What do we need to do? So we are already moving into the capabilities, but just to close the last challenges, maybe I wanted to invite Niti, because Niti, I can see your post in the chat box. So maybe I'm going to ask Niti, who's the founder of Kids World Education, yeah, and an expert in early education, to please come in and maybe say a few words to close the challenges before we move to the capabilities very, very quickly. Thank you.
Namaste, and thank you, Karen, for inviting me here. Thank you, UNICEF, for organizing this session, and it's an amazing platform to share with all the stalwarts that I can see in the education field here. Many of them are very, very senior to me, and it has been pleasure to learn from all our seniors. So I just posted one question here because this is what we have been hearing all around. Let us have this question of a debate here. We talked a lot about, socio-emotional development, what children are losing out, not only children. So if I have to talk from the perspective of the educator, there are many standalone preschools which have shut down. Teachers have lost their jobs. So what can we do to have some kind of sustainability of these preschools? And again, coming to this reopening of the schools. Schools are shut. Sometimes, in some states, they've already opened, but even if there is one single case found in the school, the entire school closes again. So this kind of the online or hybrid model is working in many of the schools right now. So is it so that when the children are at home, is it that they're really at home? Are they not moving out anywhere with the parents, and that moving out doesn't have any threat for them? Is it so that only going to school is the threat for our children? Because when we are going to welcome children in the school, definitely the school will take care. We will make sure that we do not jeopardize with the health and safety aspects of children. I'm sure all the schools will do that. So I still do not find any answer to this. Can we have some discussion on this, and can I have some inputs for it?
Great. Thanks, Nidhi, for bringing that in. I think we will be taking and moving it forward. And I'm moving into the capabilities section. So I'm sure somebody will touch on that point as well. Over to you, Nidhi.
Yeah, glad you alerted us about the time, because as I told you earlier, that with all my colleagues and such experts around, it's such a pleasure listening to everyone that I would not be able to monitor the time. So thank you for doing that. And also, I think we've just got into the right section. I mean, the conversation is going in the right direction. I think talking about school closure and talking about capabilities and strategies, we are moving in that domain. Farida has made a very important point, which is about decentralizing decision making and getting the communities and the parents, not individual parents, but parents as a community, to come together and decide whether they want to open or close the schools, because they are the ultimate stakeholders, and they should be able to have a voice in it. So already from the first wave to the third wave, I think there has been some element of this decentralization from the Government of India deciding to at least come to the state governments now to have the freedom to decide. But it should further decentralize, perhaps, to involve communities in the decision making. So that's a very important point. And at this point, I think we must have a health perspective coming in also. And we have Dr. Chandrakant Laheria, who is an epidemiologist here with us. So could I invite Dr. Laheria to talk about what are some of the possible strategies to build this public consensus on reopening of the pre-primary schools, in particular, schools in general and pre-primary schools in particular, and Anganwadis.
Thank you very much, Dr. Kaul. And I was listening to other panelists also. It's always a pleasure. A few things, and I'll try to be brief in interest of the time, that what we know in the last 2 years, we have developed a far better understanding of pandemic, but also how people respond to it. So at the beginning of pandemic, it was appropriate to close the school. The reason was simple, because this SARS-CoV-2 is a respiratory illness or respiratory virus, and respiratory illnesses usually affect either older people or younger. The adults are protected, but in the 18 months into the pandemic, we realized that this is different from all respiratory viruses, and that this virus infect all age group, but the serious outcomes in terms of moderate to severe disease, hospitalization, deaths are low in children. And that is why WHO, along with other organizations, including UNICEF and UNESCO, made a statement that it's safe to open school. In fact, what we are hearing that school should be last to close and first to open. And that's what most of the countries did, especially after July, including the Delta wave, which happened in September, October, November in many countries and last year. And then even in Omicron wave, exactly that was the pattern which countries followed. They closed school last, open first, and that happened in quick succession. I've been working in this with the medical fraternity, with my colleagues in pediatrics and other public health, but also with the parents and education. And what is the summary challenge in India? Why schools continue to remain closed, especially for younger children? And before I move to the next part, the key that there is a scientific evidence that younger children are at the least risk. And of course, we heard about the learning loss for younger children. But one of the challenge in India has been, there are few challenges. Like I was talking to some of the policymakers and parents. Most of the time when we bring argument that there is a learning loss of the children, people simply brush it away and say, नहीं, वो learning loss तो हो रहा है, वो तो कोई नहीं, हम उसको compensate करा देंगे बच्चे को extra classes. So the learning loss is not a compelling argument for parents or many of the policymakers. Second thing in this pandemic happened that policymakers played to the public sentiments. Parents and a few vocal individuals kept speaking that let's not open this school, while the truth is that the risk is low. The medical science clearly tells that children are the low risk, but it is definitely not zero risk. Now, the argument someone gives, the parents or other people give an emotional argument that's not zero risk, who will take guarantee? Now, to respond to this is really challenging because health experts are not trained to be good science communicators. Even the education experts are not trained to be science communicators. So what happened? The lack of the trust. The parents were not trusting government, doctors were not trusting anyone. Like everybody had made their own assumption in the previous 18 months of the pandemic based upon newspaper reports and WhatsApp forwards and misinformation. And people were not willing or budged from their stand which they had taken. So the lack of trust, insufficient science communication, these have been some of the challenges. The learning loss argument is not really compelling from the parents. Now, situation is that this is now February 2022, 2 years into the pandemic. There is enough scientific evidence to say that schools are safe. They do not increase risk of the children to get severe disease or increase transmission in the community. We know that scientific evidence says that there is enough learning loss and of course the developmental loss and other aspect. So now challenge in front of us is that while scientific evidence is there that schools should be open, but even policymakers like we are seeing in Delhi and other places where there is enough evidence, the transmission rate is low, but schools are not being open. As a society, we have to see that what should be done for this. A few quick things, and these are the last points. One is that it requires engagement between the medical fraternity, schools, and parents, where we build the trust between the people. Like people need to nudge or budge from their hardened stand that this is like schools are unsafe. Second thing is that we require that policymakers need to start communicating science in a transparent manner, like health expert, medical expert. Every fraternity is divided, so it is left to the top policymakers that they put scientific evidence in the public domain. Whenever policymakers speak and they decide, it happens that public start listening to them. Third and key in this is that it is, if science is saying, and that is what we know, that schools are safe, then governments need to take a lead in doing their bit, because much of the resistance to open schools, be it a pre-primary or other schools, is from the private sectors or higher socio-economic status parents. So if governments take the lead, open the school for in the government and Anganwadi and nursery, and this is scientifically supported, then I think things would change. So dialogue, addressing the mistrust, scientific communication, and government taking lead and starting the process will help in opening the school. And I have studied the scientific evidence. I have published and documented at different places. Schools are definitely safe. The risk is very, very low, but the benefits are far greater. And final point, I would say that one of the things which everyone is missing, the perspective. Of course, risk is not zero. SARS-CoV-2 is going to stay with us. But if we put the risk in the perspective of malaria, dengue, other illnesses which children suffer, the risk to the children due to SARS-CoV-2 is far lower. We do not close school for typhoid, dengue, malaria. Then why should we close school for SARS-CoV-2? That is the point. Thank you.
Thank you very much, Dr. Leheria. I think that brings in a very important aspect that you have highlighted, that is the lack of trust across the stakeholders, especially the government and the decision makers and the implementers and the parents. So I think that is something, again, it brings down the point that there's need for more discussion, dialogue with the community, with the people who are affected, with the parents, with the school people, because somewhere the loss, as you were saying, that the risks are low and the damage is much more in terms of school closure. I would request Ivan Korse, have I got the name right? He's from UNICEF in Nepal. If he's there, if he could I invite him to come in next and talk about what are some of the good practices which demonstrate appropriate use of technology to promote learning among young children. So we're going back again to technology. We have the big issue of digital divide, but hopefully if that is addressed, what are some ways in which some good practices in which technology could be used to really mitigate this impact?
Thank you, Benita, and thank you to the organizers to give me this opportunity to participate and bring a few points on this. Actually, I don't want to start with listing all different kinds of various technologies that can be leveraged for better learning amongst young learners. I think I'd like to start by making the point that even in India, it's not necessarily high tech that is the most appropriate to reach young learners with learning solutions. In fact, the majority of children don't have access to the internet, to online platforms, or even to devices to be able to access online learning, especially in rural areas. Secondly, the point I want to make before I go on is that it is especially difficult for the young learners who are not independent learners yet. So even if they did have access, they still require a lot of support from home to be able to learn. It's not enough to give them access to internet, access to a device, and just instructions to log into this or that. Most children would not know how to operate the device to have access anyway, even if they did have access. So there is really a lot more that needs to be done in order to use a combination of learning modalities to be able to reach especially the most marginalized children. So using a combination of learning modalities is key, but then you need to know which modality is needed for which child, or at least for which areas. And that is very difficult because currently, even in India, most states do not have a monitoring system that is good enough to be able to provide schools and teachers with that information. And a teacher in a classroom might have 50, 60 children sometimes, and maybe 2 have access to online, digital learning, maybe 10 have access to mobile phones, and the rest might have access to nothing. So the teachers are placed also in a situation where they need to be able to engage with their students using multiple modalities when schools close. And that's extremely difficult without support. So using the right combination of learning modalities means that you need to know who needs what. Secondly, the role of teachers is absolutely crucial when schools close. We know from evidence that students will lose less if teachers engage more. So the more teachers reach out to them, the more they will be engaged with early learning activities. The third is parents. That's absolutely crucial, and we've talked about it, so I'm not going to elaborate much further, but engaging parents and caregivers is absolutely essential, because young learners are not independent learners. They cannot self-learn and self-regulate. So they need encouragement, play, and they need the presence of parents or caregivers to interact with them for learning to happen. So all of that requires guidance for parents, capacity building for teachers, and clear strategies about how you're going to reach various children, and monitoring. So that's the whole ecosystem that needs to be looked at in order for learning to happen, especially for young learners when schools close. Now, in terms of, you might, actually you wanted perhaps me to talk about technology, use of technology, and I interpret this as multiple technologies. But if you want me to talk about EdTech, education technologies, there's so many experts, even on this panel, around this table, that know more than me probably. But I have put together a short note, which I'm willing to share. It's just that I cannot share in this chat, so perhaps I can share later. I have put together a list of EdTech online platforms for young learners that are commonly used in South Asia, in India, Pakistan, and Bangladesh. And I've tried to highlight the plus points. I'm not going to mention specific ones. I'm not going to be advertising for this or that solution. But what I do want to say is that there's everything under the sun. And some online platforms are very limited because they're basically, a repository of teacher videos and online content, basically the curriculum that has been digitized. The better ones are the ones that are interactive, that use play, which is very important for young children to learn, and that are interactive in the way that there are small quizzes to help the child learn and remember, but through play. Those are the features within online digital platforms that are probably the most efficient for learning. So I'll stop there, but I'm happy to come back to any of those points or to expand further. In the interest of time, I'll hand over back to Vinita. Thank you very much.
Thank you, Ivan. And I'm glad you talked about resources that actually build on what children really need and what children really enjoy, and that is play. So anything that is play-based will always be appealing and acceptable to children. So that is very important. And I think that a very important point that you raised was about the lack of information with the teachers about how the children's, the resources that are available for children, the resources that children have access to at home, and the need to have a more comprehensive data in schools about all these kind of details, so that decision making would be much more precise. Talking about capabilities, we move on. Karen, you wanted to say something? Yeah.
Yeah, if I could just bring one more person in, because we did speak about EdTech, and we have an EdTech, person with us all the way from Kazakhstan. I hope I said that right. Ahmed, and he's a founder of Sovet. So I think I'm going to hand it, if you don't mind, with your permission, just ask him to come in a little bit and tell us about what is his work and innovations actually in the EdTech space. Is that all right?
Sure.
Okay.
Yeah.
Great.
You are monitoring the time. So it's okay.
Yes, I'm
really appreciate, Karen. Thank you so much. Thank you so much, and Dr. Cole. I've been very attentively listening to all the speakers, and basically, I see that everybody agrees that the technology will play an important role. In which scale, it depends. So, in pandemic in 2020, when I looked at the whole situation. And myself, I'm also a teaching professor at being in Singapore. I've been teaching in Kazakhstan at university. And I've been doing it online live since 2018. I know that online live have been with us for a long time, but how we started to use it more oftenly It started only maybe in 2020, I feel, aggressively. And that brought a unique opportunity to bring high quality teachers to those areas in the world where there is a lack of teachers. Because the core for students for early childhood, middle school, high school, it's a teacher. And the situation that we come to helped us actually remove this barrier. For example, in many developing world, there are many incomplete schools, as many of us know. Incomplete schools, it's where sometimes in one village, a teacher, even though doesn't really understand math, but he teaches math because there is not enough teachers at that particular area. So in these situations, I find that, of course, if during the pandemic, they are trying to use technology, but the best technology, it's actually a teacher that can find the best technology and bring it to that particular audience. So that's why we started to build a platform that helps any school to find a high quality teacher for teaching academic courses. There are many tutoring. Like extracurriculum courses, but the problem it's why extracurriculum is booming is because the quality of education at school is diminishing. But why? Is because lack of high quality teachers, especially in remote areas, especially. But these technological advances, and we are thinking as a company, of course, not this year, not next year, but we're thinking about 5 to 10 years. And internet problem shouldn't be a problem, especially in 5 to 10 years. And at that time, the core is the teacher. How we bring, for example, to remote areas in Nepal or in Indonesia or in India, a high quality teacher, maybe, for example, geography, and they're talking about United States, it's better to have a teacher from United States teaching that particular model. So we're talking about using these opportunities, and we see a big demand on this service because based on our research, we found that during the pandemic, many times, for example, students from Nepal, doesn't matter from early childhood, middle or high school, they started to take some courses, online live courses from teachers abroad. Because parents were able to find at that particular price level another teacher that is better, for example, more available at that time. So that's what I want to share, that from technology, what we have, it helps us to find the more suitable high quality teacher. I agree, it can raise a lot of other issues, like what are we going to do with those teachers maybe less qualified, but who are teaching and earning money, but they can be requalified actually for another subject. And by doing so, a lot of this collaboration, bringing teachers from other parts of the world to, we bring this supply demand. So we hope that the market will manage so that schools that need teachers, they will find them, and at an affordable price that they can afford. So we're not talking about extra money they need to pay.
So I'm sorry, in the interest of time, I'm going to come in a little bit over here, but thank you very much for sharing that. Yeah, please feel free to post as much as you like on the chat box, because that's where we are hoping all the extra, information that I know each of the experts over here have such amazing knowledge, experience, and resources. So please keep posting on the chat box. And I've just asked everyone to please give us permission to go ahead with moving it. I mean, we may need another 10 to 15 minutes extra. So do say, add your yes over there and make me feel a little better. Yeah. Over to you.
Okay,
Vinita.
thank you.
Thank you so much. Over to you, Anita, please.
Yeah, thank you, Karen. So we've talked about technology as the way forward. And I think what was just shared was about how to bring in quality into the schools through the use of technology. And that is very much possible. I see it more as, especially for the younger child, as a tool for the training of the teachers, because the teachers can be exposed to very good practices. and also a lot of reflection through good quality teacher education programs, which can come in through technology, especially for the younger children, because they themselves don't benefit so much from it. But there are other ways also, and with technology we are seeing in a wider perspective. So we have Dr. Dheer Jhingran here, who is an expert at language and early literacy, and has done a lot of work, and he's a director of the Language and Learning Foundation in Delhi. So Dheer, can I invite you to talk about what are some of the things that you think, now that we hope that the preschools and schools will start opening and stay open, what are some ways in which we could have some kind of teaching learning practices which will be able to address the losses or the lags that the children have been facing in the last 2 years. Dheer, are you there?
Yeah, I just got back on. Can you hear me?
Yes, we can hear you. Yeah, can hear you but cannot see you.
Okay.
Yeah, now we can. Yeah.
So thanks, Vinita. I would like to talk about just 5 initiatives that could help, when schools reopen. And I'll focus really on early years in school and academic learning. And my emphasis is here that we have to try and work with the government education system to ensure that these things happen at scale. That's the responsibility of UNICEF and other CSOs. The first one, we need to begin where children are today in their journey of learning. So to understand where they are, where should we begin? Building the foundations of previous grades competencies, rather than starting with, if they're in grade 3, let's start teaching grade 3 curriculum. Of course, building some accelerated learning there. So we are working with several state governments to develop a bridging curriculum for the next 2 years, so that the next 2 years are transition years where the learning outcomes, what needs to be taught, will be designed specifically to take care of where children are and where they should reach. Number 2, break down the curriculum into week-wise chunks so that it's more structured. The teacher knows, what should be covered in the next 1 week. Of course, that's not textbook chapters, but what is the content? What are the skills? This also helps, if there are any further breaks, then it's modular. You've ended here, and where should you begin next? So a more structured approach to the curriculum. Number 3, very important to track students' learning on a regular basis through formative assessments by teachers. We are not talking of big, statewide assessments. And this is especially crucial because, as everyone has said, disparities have increased. There are children who had no access to digital learning at all. And it's very, very important that we know which children are struggling and how they can be supported. And this is to Chitranjan's point, that this is as good a time as any to talk to teachers and the education system about issues like inclusion, equity, most deprived parents. So track children's learning and have methods of ensuring that the children who are falling behind get supported. As everyone has said, build a substantial component of socio-emotional learning to cope with the negative psychosocial impact that's happened, which can be done in many ways, circle time, talk time. And I'm drawing basically from early childhood methods, basically, and that should come into early grades. Free play, fun learning activities, use of children's home languages, letting them talk about their own experiences. And this should continue for a long time. So that's the third point, really. The fourth. And the fifth, of course, as everyone has said, to be engaging with parents and not transferring the responsibility for learning to them, but ensuring that they understand what's happening at school and actually closing the distance between the school and the parents. That's been a big challenge throughout. And for this, we have to work with teachers. And really, these 5 points that I talked about really are, in a way, reforms. While we are saying they're initiatives, they're actually reforms. And this is a great opportunity to be doing teacher professional development in a different way, to be talking about, ensuring that every child is learning, inclusion and equity issues, including their languages, and all of that this is a great opportunity to do that. So I thought to begin with, I'll mention these 5 points as schools reopen are very important to work on. Thank you.
Thank you, Dheer. I think those are very, very significant and very much needed initiatives that need to be taken. But the question is, how will that happen? Because as we see this, there's always this sudden opening, subject to the pandemic status, the reopening or closing of schools. I just wanted to know that, is there this kind of, are these initiatives being taken at the systemic level to be able to engage teachers in all this? Or what is the modality to reach out at scale?
Yes, I'll just take 30 seconds more. So what I'm saying is some things that have been attempted in 3 states at statewide scale. Of course, the work that has happened in the 3 months that schools reopened was somewhat limited, but this is preparation for the academic year 22-23, where a bridging curriculum has been prepared. Teacher trainings will now focus, and teacher guides, manuals will now focus on understanding children's learning on a regular basis, and also, of course, preparing the entire academic support system to be looking at equity inside the classroom. So this is work that's happening, and in preparation for the 22-23 session, revised workbooks, revised teacher training plans, to be able to see that the next year, we are able to build from the foundation of a grade 3 child would learn essential competencies of what should have been learned in grade 1, grade 2, and then they only move on to grade 3. So a lot of preparatory work has happened at the system level in 3 or 4 states.
Thank you, Dheer. Could I now invite Joyce Poen from UNESCO to talk about what have been some of the positive examples or best practices adopted for reaching children through parental communities during the closures. This is without addressing the teachers, but as Dheer mentioned, that it is also important to bring in the parents. So what have been the ways to some good practices for reaching out to the parents?
Thank you, Ms. Benita, and nice to be here on this panel. It's true, actually. I completely agree with all of the panelists and speakers before me that this is a very difficult subject to talk about, and it actually is more of the issue of trust, cooperation, and also the sharing and the understanding that we are not alone. Not only are we not alone here facing these consequences in India, but also all over the world. And I think that's one major aspect that perhaps policymakers and also those that are in the know can do, which is to share the experiences of communities, parents, and all those caretakers and caregivers in handling the situation. And for UNESCO's part, I'd like to talk about 2 aspects of our work and what we have seen, not only to work with parents, but also parents who happen to be teachers or teachers who happen to be parents. And one of that is through our Associated Schools Project Network, which is a network of educational institutions across the world that work to promote the values of peace and intercultural dialogue. And there was a conference or a summit among all of UNESCO's Associated Schools Network, which involved students, parents, as well as teachers of these educational institutions. And some of the practice, well, while it was, of course, contextualized in their own specific countries or situations, some of the things that have come up is the understanding that, again, that we're not alone, is that what's necessary in terms of thinking about reopening schools, continuing learning, and because of school closures, is the idea of, even if we open schools, what kind of education and how do we promote learning now is actually what's the thought, what is the most important, because things cannot go back to normal. We know now through hybrid, through online learning, even at the remotest areas, we cannot continue to just depend on perhaps one source of education. There are multiple ways that children, learners learn. And what kind of quality education is it that teachers, academicians, and policymakers need to promote? And how can this type of quality education be promoted among everyone and supported by everyone, including parents? So that was one clear message that came out of the summit. And another is that parents themselves, unfortunately, it's not exactly a best practice, but it's an eye-opening in that they also need to be able to share their own frustrations. We've heard already, we talk about mothers, we talk about working mothers, working families, single parents, etc. They need to also have outlets, and there must be a way that the parent doesn't necessarily just hand over education to teachers and schools, but also be involved in the type of learning that happens. And this also perhaps may not necessarily be in the hard subjects, but soft skills, such as how do we encourage understanding of the other, or more empathy. And I've seen in the chat that yes, indeed, vulnerable children, children with vulnerable in vulnerable situations are those that are especially hit with in this throughout this pandemic. And so how can parents of in such a situation be also involved in exchanging with teachers and participating, if they can, in these practices? And so all this issue about the future of education is also something that UNESCO and a lot of other organizations, including UNICEF, have been thinking about. And UNESCO has recently launched its Futures of Education report, which is literally entitled A New Social Contract, because it is a contract among not only the educators themselves, those that are on the front lines, teachers are the front lines, and also involving the health officials, which another speaker has very poignantly spoken earlier. It's a social contract to figure out how, number one, do we open safely schools and educational institutions because for its importance, but the kind of education that we aim to bring to our learners, young students and the children, so that we can not only try to make up for all of this learning loss that has happened, but try to make education systems also be more resilient, because in the end that's what we need, the resilience of students, of teachers. If ever such catastrophe like this or any other, we're not even talking about climate, etc., but that's what I had wanted to speak on very, very quickly during this speech. Thank you.
Thank you very much, Joyce. I think that's very, very important. Again, bringing point back very starkly that schools can no longer function just on their own. They need to be involving parents, and parenting and schools and parents need to come into a partnership to be able to really bring in successful education for children. So I think parenting is here to stay in a very major way. And having said that, that helps me to take this discussion forward to Zakia Kurian, who is founder trustee of children of CLR, just Child Resource Children's Learning Resources, based in Pune. And Zakia, how can parents continue to play an active role in supporting the young children's thinking? Joyce has already just talked about it, but more importantly, without getting overwhelmed with the burden of it and the responsibility of it. And do you think technology, I mean, we have had some discussion on this, but do you think technology can really play a role in being able to get parents to be more actively engaged?
Well, thank you, Vanita, and thank you for the organizers for giving me this opportunity. Actually, Vanita, a lot of the answers to the question in this discussion, as far as I can get starting from Dr. Seshadri's as far as the very early learning is concerned. I have a problem perhaps with my internet connection, so I may turn the video off if that's going to be a problem, okay? But just to come down, I was actually asked that to talk more within the space that had to do with collaborations. But I will answer your question in terms of the direct reach to parents. I think in a little more, I mean, I think between Shubhra, Chitranjan, all these people, that question of engagement of parents and at what level and how much the socio-emotional will matter in many ways far more than curriculum, quote unquote, etc. You know, but one of the things I think which I think is important to stress is that parents are concerned about the learning loss. You know, and therefore there's an anxiety about it amongst parents. And I speak from having been associated with various NGOs in the recent past who are trying to reach out to communities and do community-based work during the pandemic. And therefore, I think one of the messages to parents is this, that catch up and the anxiety for catch up has to be reduced. But at the same time, as Dheer mentioned, I mean, part of their anxiety also has to be addressed. And therefore, the kind of 5 points that he laid down, I feel are of the essence, you know. And if there is, I think in terms of, there's an in-between, we've talked about teachers connecting with parents. We've talked about technology and maybe connecting with parents, though the data is that most households do not have the kind of devices that we would, and therefore the very simple WhatsApp messages, audio messages, which kind of span both little activities, very simple activities in play and developmental domains, you know, as well as the messages that have to do with comfort and the kind of loss that the households have faced, etc. Combination of those things with a very simple technology is actually what in the near future can be accessed for directly for parents. If we talk about any kind of equity angle, then it is the simplest technology that can reach. That's my understanding. But one of the things that there's an in-between, which has to do with the community at large as support to parents. You know, their parents can be reached out to through simple technology, through teachers being engaged with parents, schools being engaged with parents. But at the community level, and especially now that we're talking about pre-primary, preschool, Anganwadis, and so on, I think we must remember, even in statewide kind of approaches that Dheer talked about, but probably this is already being done. But one very important body is the Bal Vikas Samiti. I think that a lot of hope can be held out for the Bal Vikas Samitis at the village level and in various areas, as long as the constitution of those committees is really thought about, that the people who are willing to really take this on as a kind of in-between, even a liaison that can help between Anganwadi workers, helpers, home visits, parents. It is the Bal Vikas Samiti that should be empowered to do this, their training, their capacity building, and so on. Also, I think local panchayats and selected members of the local panchayats. I'm told, you know, Dr. Seshadri mentioned the Karnataka initiative that's been recently taken on, which I'm part of that. I'm told that where there are lack of funds when it comes to women and child development, and as Farida has pointed out just now, budgets are even cut further as of now. I believe that the panchayat also has funds that can be used for community participation, community awareness in terms of how parents and schools, the liaison between parents and schools, parents and Anganwadis particularly, and can be brought about. So this is something that I wonder whether those who are at the very sort of top of the technical support ladder, so to speak, for both parents and schools, how do they engage also at this very basic community level through the bodies that exist? These are statutory. I mean, the Bal Vikas Samiti is a statutory body, and we should be making very good use and making sure that the constitution is right of these bodies, because we also have experience from DPEP and other earlier that village education committee, depending on how they are constituted, even school management committees. You know, if there's a namke vaste kind of involvement of people, it doesn't work. So this is one of the things. And, you know, with parents, in terms of the actual messages, I think the biggest resource, apart from the little play activities and taking forward simple kinds of activities, the biggest resource they have is language, reading. If picture books, be looking at books, even if there's no kind of other worksheets and things have to go to them, but if what they have already can be really built upon. And I think that in terms of learning packages, you know, UNICEF has brought out, the Innocenti Center has brought out the thing that simple learning packages could go out, but I don't know at scale how this can be done. And we don't want to do things which parents would be overwhelmed. And therefore, but how about some form of community-based thing where books can be exchanged for children and parents can read aloud? Because now with the more and more universalization, there are younger parents. There are parents who have gone through schools and can definitely read to children, apart from the kind of audio things for storytelling and so on and so forth. So I think I'll end here. I hope I've answered the question with it.
Thank you, Zakia. Yeah. I think we have further added to the already emerging discourse on collaboration. So we've really come to the actual collaboration, the possibilities of collaboration and the need for collaboration. And what is coming through very, very strongly is that we cannot leave the entire education to the single classroom and the single teacher. It has to be a social responsibility. It has to be in a mission mode and bringing in all partnerships possible, including the panchayats, the Bal Vikas Samitis, and so on. But again, the budgets are very important. And I think somewhere it's very important to do advocacy to be able to bring in education as a very, very significant area for politically significant for electoral purposes more than anything else. So that with the budgets competing for in various areas, education gets priority, which unfortunately in day before's budget also was not there. So I think somewhere we need to be looking at all this.
Vinita, may I come in, please?
Yeah, please.
Yeah, we are actually at the end of our formal time, actually, as per the schedule. But as we've all agreed that we will move it and take another 10 minutes or so, I do want to bring in very quickly Deep, who's the program director of VIBHA, and who also happens to be our co-host and partner for the session and for the summit. So if you don't mind, I'll call him very quickly. And of course, we will be closing, so I'll leave it to you to do that as soon as we
We have just one more person, Vinita Bhargav, Dr. Vinita Bhargav. Can we bring her in first? And then we can
just go ahead with that. Yeah.
Good afternoon, and thank you so much for having me here, Vinita. I hope you can hear me.
Yes, very clear.
So I'd just like to position myself, one, as a person who's been working with children who have got abandoned and, destitute, and also as a teacher at the University of Delhi and just retired. So I want to bring in the deep collaboration that is possible between higher education and early childhood education. Over the last few years, what I have tried with the Delhi government is to see, and also what is very relevant for the last 2 years, as it has happened with higher education, that we've had fabulous speakers from all over the country and the world come in and talk to young students, both graduate as well as postgraduate students, but we have not given them any hands-on experience with children. We haven't been able to send them to the field or to do things that would be fun things for their own learning. And this was what I was able to do, through Delhi government, where I would see that our students would go to various spaces to play, to interact, to actually give children fun and to give children a sense of, that which they've missed out, that safe space, the emotional space. And I agree with Professor Sheshadri, where he said, I'm not so worried about the learning. Children will learn, but I'm worried about the emotional trauma. And I've seen it because I've been working with these children who have lost both parents or a single parent. And it has really also in homes where there has been violence, parents have lost jobs. And I think some of the students, and if we are able to create some kind of interesting packages for children, for students who are in universities, and they can actually legitimately get some kind of an internship offer, which allows them spaces within the government school system or early childhood education, large early childhood education programs. I think that collaboration between higher education and this space in the field, where I think teachers are overburdened, parents are overburdened, and I think there is a huge need for students as civil society. See, we got it in when young medical students were out there doing stuff in the field, treating patients with COVID and other things. I think we can get our universities out into spaces where young children take up, can actually heal. I would really call it healing, because I think that's a huge thing before any learning can happen. I have seen the deep trauma that has happened all over. I think even our institutions like the CCIs, the childcare institutions or orphanages, didn't have enough staff. They were run on a very, very meager staff and a whole lot of children with trauma. And I think pretty much the same situation is likely to happen when our children come back to school. Here I'm talking about children from very disadvantaged migrant families where they've been through a really bad deal. So the safe spaces have got lost, not only learning spaces. I'd like to stop there. And thank you, Vinita, for giving me this opportunity.
Thank you, one Vinita to another. Yes. Karen, yeah, would you like to bring in?
Absolutely. Deep, would you like to come in, please?
Yep. Hi all. Can you see me?
Yes.
Okay. Hi. Thank you so much, Karen. And it's a wonderful experience for us, as well as an opportunity for VIBHA to partner with everyone, all of you out here at this summit. And I think this is the second time round we've joined, RISE. And the values of RISE resonate very strongly with what VIBHA believes in as well. So, there's very little I can say. Everything has been already said by everybody who's so experienced and experts in their own field and so much more knowledgeable. Just to give you a brief, my name is Deep Ranjani Rai. I am basically from Nepal, but I am based in India, working with VIBHA for the past 11 years. We just flashed by. I was quite shocked to know that. And I've been with the development sector since 1982, I think. And it's been, I fell in love with the kind of work that we do with NGOs, particularly on ground, on looking at, ground realities and working with people on ground. So some of the things that have popped up, which is of, imminent interest to VIBHA, particularly because our mission statement says that we believe in working very closely with partners on ground to improve the public education system. And it is no intention of ours to create alternate systems anywhere, because we believe that the biggest thing across, say, pan-India or pan-world is the government system. And we need to work with the system if we want to bring about improvements. So a lot of things has been said. I think we've identified challenges very clearly about what's facing us. So there are a couple of things that need perhaps a bit more larger discussion is around the issue of assessments. We've been talking about, whatever we say about SEL or about the other development aspects of children, academic learning in the world, in the way we are, fortunately, unfortunately, does take precedence in many of the cases on ground, as other partners will probably agree. And I think when we are looking at assessments in today's times on school reopening, not opening, blah, blah, blended learning and all that, we need to ask ourselves the questions: what are we assessing? Where are we starting from? And do we need to start from there? So I agree very strongly with what Dheer said earlier, that the next 2 or 3 years is transitional, is crucial. We can't cram things down people's throats. I had some feedback from one of our partners on ground to say that they were handed a package by the government, which is compacted 1 month learning package, which they expected teachers to take forward to teach the students to cover the 2 years of gap. I think somewhere we need to get our, act right to say that we do need to bring in the governments. It's not just about having a policy in place or guidelines. There are millions of guidelines. We got so confused eventually with the Corona times guidelines that were given by the government that, we had to sort of make our way through it, meander through it, and wend our way through to find which is the best way forward. So somewhere, as Elizabeth said, yesterday, that we need to look at intent with action. Only a statement of intent is not good enough. And we have to get out of the syndrome of saying, at least they've said that. We don't want that least. Why are we setting the bar so low? So if there is an intent, there has to be action. And it cannot be left to civil society only to deal with everything, to plug every hole that appears. It's like a war with the rivers when they're raging in spate. So, it's time that the government stepped on board. I was actually expecting to see somebody from, at least from Niti Aayog, out here to listen to what people are talking about, and we should have got them because they're really good at what they say. But at doing, I'm not sure. So, state governments at the national level, state governments, everybody needs to come in, put your money where your mouth is. You have a lot of money in education. Every state budget has mind-blowing amount, crores, thousands of crores. That needs to be Srot Parichalan, as they call it, it needs to be mobilized. When are we going to do that? We can't keep looking to donors from outside and corporates all the time. Everybody's got their own, limitations. So we need to do that. Reality for NGOs and CSOs working on ground is academic learning is important. We can't get out of that. Whatever we feel or say, we need to do that. And then if we are going to look at the other development aspects, are we geared for that? Do we have the capacity? I know that the collaboration part and all that comes in, but it has its own set of issues there. So I think that is something that we all need to really talk about and discuss. At least we are having a lot of that with our partners.
Absolutely.
And
Deep, I'm sorry,
yeah,
I'm going to
yeah.
come.
So I'm done. So I'm just
Yeah.
waiting.
No, absolutely. Telling it as it is and telling it for whom it should be said to. Absolutely.
Well, yeah. Okay,
Thank
thank
you
you
so
so
much
much, Karen.
for
Yeah, yeah.
bringing in
I
that
was just venting.
perspective. Yeah, I think we're coming to our close. We definitely don't want to over exceed this our
Yes.
invitation to everybody. So, Vinita, may I request you to maybe sum it up, and then of course we will hand it over to Terry to bring it to a close. Please, over to you.
Okay. Thank you very much to everybody for a very, very rich discussion, very, very good ideas that came through. There's no way I can summarize it within a matter of maybe 3 more minutes.
Yes, sure.
Yeah. So all I can say is that taking off from the last what Deep said just now about academic learning, there's no way that we can say that academic learning is not important. But I think it is very, very important that to understand that academic learning is also dependent upon the larger socio-emotional or mental health or physical health of the children. And therefore we need to look at education, reimagine education. And what is coming through from the entire discourse of this morning is the very urgent need to reimagine education as one which is a kind of a mission responsibility, so a social mission or a responsibility of the whole community, which needs to be the community, the different players in the community or partners in the community need to come together. And therefore the school system needs to open up to parents, to teachers, to technology, because I think that this was a kind of a stopgap arrangement to bring in the blended learning and so on. But this, I think, needs to stay because we don't know what kind of eventualities we'll get into. So somewhere bringing in partnerships, complementarity, supplementarity into this classroom situation to be able to not only improve the quality, as was said, that technology can help to do that to some extent, especially for the older children, but for the younger children to be able to bring in the parents very meaningfully into the school system, sensitively, with due respect to the parents, because very often there is a kind of a confrontational relationship rather than a collaborative relationship. We need to build that collaborative relationship and recognize that. And I think that the pandemic has shown how parents can really come in as very effective partners to bring in the educational, bring in educational gains to the children, and also look at education of the younger child. Not, again, I'll repeat, academic learning is important, but not look at the education of the younger child as an academic endeavor, but more as a child development endeavor, where there is much more emphasis on being able to work towards addressing the needs of the whole child rather than just the cognitive needs of the children. And I think that important thing is in terms of collaborations, to actually bring in effective means of some kind of mechanisms, systemic mechanisms to be able to make the different partners that we are talking about, parents, teachers, and school system, as well as technology, as effective collaborators in the whole process of education. For that, I think we need to be doing some more work in terms of what are the kind of guidelines that would be needed for each of these agencies to be able to really bring in a much more kind of sustained and enriched education. I think that is very important. And I think that gives us the last point that Deep said about intent with action. I think one of the documents that we propose to bring out is a call to action for the government. I think that should be the title of the document. Thank you very much. Thanks for giving me this opportunity. Yeah.
You know, I really feel bad. We don't have enough time to bring in all the wonderful voices that are here because, of course, they are very, very important, and which is why I would still request anyone who has not yet spoken. I know I can't call you in to speak right now because it would be really impossible. The time is way over. But I would request you, please put it in the chat because we are collating all of this into the reports, into the outcomes that we are looking at taking further with UNICEF as well. So anyone who has not had a chance to speak but would like to say something, please put it again in the chat box, is my request of you. We need to really close this. This has gone and beaten even the previous records of the 10-minute cap that we had put. We already passed the 10-minute limit, right? So now I'm going to request and call on Terry Dunant, who is the Chief Education of UNICEF India. My apologies if I did not pronounce that right. He joined UNICEF, was appointed in 2019 after working with UNICEF Nigeria for 5 years. Prior to Nigeria, he served as the Chief Learning for Development at UNICEF State of Palestine. Before joining UNICEF, he was the Regional Education Advisor for Save the Children Sweden in Bangkok. Terry is an educationist with over 30 years of experience in Canada, the Middle East, Africa, and Asia. He started his career as a secondary school teacher in Northern Canada. Terry, over to you.
Thank you very much. I feel like all I can say is wow. After that last 2 hours, what is there more to say? Such a rich discussion. But I think that the whole call was really summed up, I think, by Vanita at the end, action with intent. I think, as she said, this is really, and there's so much intent over the last 2 hours. And really looking at the needs of young children and how the disservice currently in situation and how much more they need holistically. And their needs are, learning is important, academic, but also the whole area of developmental and the important role that parents play, teachers, and community. How do these come together? And it's really, I just see the chat's probably, it's really about collaboration. I think this venue event is, I see is a huge, big step in looking at how we can greater collaboration in this area, as I think there's so much more that needs to be done. When still, I think it's about 14 states, for at least for primary, still closed. Anawati centers, I think there's only maybe 6 states with Anawati centers open, maybe less. So I think it's important to be concerned what is happening and action to go forward. So I think going forward is the next steps, and how do we advocate for the reopening of the full reopening of Anawati centers, pre-primaries and primary schools. So I think coming out of this discussion is really developing a note or a document around that. It's so crucial. But a document, but also a process. That it comes back to this, and if we call, and the second one's looking at call for action. How do we bring stakeholders? And I think from the discussion, I think it's going to be really essential for the call of action. How do we bring the voice of parents and communities and maybe even children? Because there's stronger, I think, voices that I'm hearing that wanting the reopening. But I think it's really crucial to be clear what needs to happen once they reopen. And I think Dear really summed that up in terms of it just can't go back to business as normal. And the call for action needs to be, how do we start where children are and in their best interests, not the best interests of the system, and therefore things need to change. So in the call for action, we need to call for the change for what children need. So coming out of this wonderful discussion, I think it's the call for action. But first is really look at the advocacy note, how they link up and move us forward, and hopefully move forward with the reopening and learning environment that's safe, developmentally sound, going forward. Thank you very much.
Thank you very much, Terry, for really putting that in perspective and giving a call to action, because that's exactly what we want as an outcome from our conversation, that it goes beyond the discussion into the action. So thank you for bringing that up. And we come to a close very quickly, a little bit that I want to share, that, the whole summit is focused on the SDGs, and more often than not, we obviously recall the SDGs as the 17 blocks. But in our mind, it is really, it's really like a woolen ball of 17 colors that are so tightly entwined, interlinked, integrated, whatever word you want to use. But the fact remains that you really need to expand and think beyond the single SDG that you are focused on. Focus is great, no two ways about it. But I think also making sure that you, apply an ecosystem lens and look around and see how do you connect various dots makes a big difference in the way that programs are designed and implemented and assessed at the end of the day. So, and that's a strong message we want to go out at every roundtable and every action that we're doing at this summit. The second is we are trending on social media. So please, if you want to give your feedback, opinions, and I know some of you may be upset too with us because we don't get a chance to get everybody in, tell that to us. Tell the world how great we are. Use the hashtag RWS22. And last but not the least is please explore the portal. There is a lot happening. As I said, over 100 hours of programming, 3,000 people from over 54 countries. So do check it out. There are almost 20 different formats, including some fun stuff like the cultural activities, the tours, the fireside chats, etc., and more. And of course, don't forget to join us for our closing plenary, which will happen tomorrow at from 5:30 is the Nutrition Awards, the Glenmark Nutrition Awards, and then from 6:30 are the RISE Awards and the closing ceremony. Please join us, and thank you very much for being with us today. We truly, truly appreciate every moment of your time and your expertise and knowledge. Bye-bye.